Hello and welcome to another episode of Dhai Akhar Voice. Today we have Dr. Teesta Soman once again in our show to discuss about the various aspects of vaccination for COVID-19. Let's speak to Dr. Teesta Soman, who is a staff physician at the SickKids Hospital in Toronto. Welcome, Dr. Soman, to Dhai Akhar Voice once again.
Thank you so much, Manoshi, for inviting me once again to Dhai Akhar Voice. It is really my pleasure to be here today. Dhai Akhar Voice discusses so many important social issues, and I'm really happy to be part of this. And what could be more important of a social issue today than the COVID vaccination? So I'm really happy to discuss with you and our audience about this vaccines.
Dr. Soman, to start off with a question, what are the different vaccines that are available in the world today? And what are the vaccines that are available in Canada for COVID 19?
There are a lot of vaccines available, especially given that we all had such a short time to develop these vaccines. So we are surprised at the number of these vaccines, and I'll just list a few of them for you that are actually already available and people are getting them around the world. So the mRNA vaccines are Pfizer and Moderna. Pfizer was the first vaccine that got approved by FDA, and soon after Moderna also got approval. Both are manufactured in the US. The other vaccine that is widely available is the AstraZeneca Oxford vaccine. This was driven by a UK group and is manufactured in UK, US, as well as in India. In India, this vaccine is known as Covishield. Now, China also has a couple of vaccines. China has the Sinovac and the Sinopharm. Those are inactivated viral vaccines. And then there is the Sputnik, which is the Russian vaccine, which is a viral vector vaccine. So these are all the vaccines currently that are being given around the world. And there is a lot of data coming from these vaccines.
So, what is the difference between these vaccines? If you can talk about the efficacy of these vaccines.
Right. I think it's really important to know the efficacy. And the most important thing to know is that most of the vaccines that have been approved by Health Canada, all the vaccines approved by Health Canada and FDA, have been shown to be efficacious. So the vaccines that are currently available in Canada is the Pfizer vaccine, the Moderna vaccine, and the AstraZeneca vaccine. There's one vaccine that is shortly coming to Canada, which is the Johnson & Johnson vaccine. So what is the efficacy of these? So we have efficacy from trials, and Moderna as well as Pfizer have shown over 90% efficacy. AstraZeneca has shown about a 75% efficacy. But more important than that, I think, is to know what is the real world evidence. So since these vaccines have started being given, there has been a lot of research and data collection in countries, primarily Israel, that has vaccinated most of its population. There is the UK and US that have also collected a lot of data, and some from Canada. So what is this real world data telling us about the efficacy of the vaccines? So firstly, all the three vaccines that are available in Canada right now, so Moderna, Pfizer, and AstraZeneca, have been shown to have a 70 to 90% efficacy in preventing disease, so preventing any infection. Secondly, there is the prevention of hospitalization, so severe disease leading to hospitalization. The prevention is 80 to 90%. And lastly, we also see there is prevention in mortality or death, which is also 80 to 90%. And in fact, in Pfizer vaccine, it has been shown to be prevention and mortality as high as 94 or 95%. So these are really good vaccines. They're very efficacious and really useful for all of us to get at this time. As you see from this chart that shows the daily COVID-19 vaccines administered per 100 people, And it shows the data from 20 countries worldwide. We see that Canada is quite high and doing really well with regards to vaccinating their population.
Dr. Soman, you just spoke about the Moderna vaccine and Pfizer vaccine being mRNA vaccines. So, what does that mean? What does mRNA technology mean?
That is an excellent question. mRNA technology is a very new technology for production of vaccines. In fact, Pfizer was the first vaccine to be granted FDA approval with this new technology. So, to explain mRNA technology, let me talk a little bit about what vaccines do. So, with a vaccine, we introduce a little part of the virus into the body, and that then creates a reaction in our body to produce antibodies. And the antibodies will go and neutralize the vaccines and stop us from falling sick. So, as in the older technology, we introduced a part of the vaccine, the virus itself. With mRNA, what we are doing is we are introducing a piece of the code of the vaccine. In this case, which is the spike protein. So the spike protein is present on the surface of the vaccine. Imagine it to be like little spikes sticking out from the virus. And the protein code of that is put in this messenger RNA, that is the form mRNA. It enters our body, it goes into the cell, and it tells the body to produce that protein. Once that protein is produced, the body recognizes that as a foreign body, and our cells are producing antibodies that will then neutralize and they'll be prepared to fight that virus. So that is what the mRNA technology is.
Dr. Soman, people have been saying that they are experiencing some side effects after the vaccination. So, what are the common side effects that people may experience?
There are definitely side effects for all the vaccines. And the most common side effects are pain in the arm where you get the vaccination. You can get body ache, some fatigue, headache, and fever. Some people also experience chills along with their fever. They can get more severe body ache. They can get nausea and vomiting. But these are really the most common side effects. And this is true across Pfizer, Moderna, as well as AstraZeneca, which are the three that are, in question because that's what we are getting here in Canada. But I do want to touch a little bit upon the really severe side effects that people are really afraid of. And as we have heard, one of the more severe side effects is the severe allergic reaction that people can experience. That can be with the mRNA vaccines, Pfizer and Moderna. Definitely, and this is really for people who have some side effects, not just side effect, but a severe allergic reaction to one of the components in the vaccine, which is polyethylene glycol. It is a very, very, very rare side effect, and but it is something to be aware of. And if you have a severe allergic reaction to anything else, it is definitely worth discussing with your doctor whether or not it's safe for you to take the vaccine.
We have been hearing that after getting the AstraZeneca vaccine, people are getting blood clots. And if you can talk a little bit about that.
So that's a great question, Manoshi, because I know there's a great fear amongst people about this severe reaction of getting blood clots. So while it is true that you can get blood clots, it is a very rare, though a serious side effect of the AstraZeneca vaccine, and likely even of the Johnson & Johnson vaccine from what little we have heard about it. The important thing to realize, I think, is that the incidence of this side effect is really, really rare. It can be life-threatening, but it is very rare. So I just want to give you an estimate of the risk involved in getting this vaccine and getting a blood clot from the vaccine versus getting a blood clot from any other occurrence in our lives. So the risk of getting the blood clot from this vaccine is 4 in 1 million people. Compared to that, if you're a smoker or if you've ever smoked, the risk is 1.2 to 3% will get a blood clot. So, or 1.2 or 1.3 people out of every 100 people will get a blood clot. What about pregnancy? If you've ever been pregnant or know somebody who's pregnant, the risk in pregnancy of blood clots is really high as well. Same with oral contraceptive pills. Again, the risk of oral contraceptive pills is not as high as smokers, but it is higher than people who are getting pregnant or in the postpartum period. There is also a high risk when you travel. You can get blood clots in your leg. And all the risk of all these conditions I've mentioned is far higher compared to the vaccine. But now consider with COVID infection, what is the risk of blood clots? If you get a COVID infection, your risk of getting a blood clot is almost 20%. And this has been published in the Lancet. Almost 20%. You could get a clot in your leg, in your lungs, in your brain. And compared to that, the vaccine is much safer and keeps you safe from severe illness, which can give you these serious blood clots. So I think while we need to, have that perspective that yes, it is a serious side effect, we also need to maintain the perspective that the risk of getting the blood clot is far lower than actually getting the disease.
We have heard that people who have got vaccines, they also are getting infected by COVID-19. Is that right? And why so?
That is true. A small number of people have gotten the infection even after receiving 1 or 2 doses of vaccine. And let me explain why that can be. So, the first reason is that different people their bodies react differently in terms of producing antibodies. Remember, in the beginning of this talk, I mentioned that the protection from getting the infection is 70 to 90%. So obviously there is a 20 to 30% chance that there are people who did get the infection or who could get the infection. But even those who do, if you recall, we talked about how the severe illness is much less and hospitalization is much less. So there is an advantage, even if you do get the infection, that you are not severely infected. The second reason is that a lot of people get the infection before their body has had a chance to develop the full immunity. And we know that after the first dose, it takes about 2 weeks for the body to develop good immunity. And even that is not the full immunity. And then after the second dose, it takes another few weeks for that full response. So when you have received your first dose, especially in the first 2 weeks, you are more vulnerable or as vulnerable as you were before the vaccine. So you still need to be really careful then. And then after the second dose, again, it takes another couple of weeks to develop the full immunity. Having said that, you still need to really maintain all precautions even after you receive the vaccines because nothing is 100% and you could still contract the illness. The third reason is that there are a number of variants that are floating around, and we have heard about the UK variant, and we've heard about another variant from India. We've heard a variant from Brazil, a variant from South America, a variant from South Africa, and we have seen that some of these vaccines are not as effective against all these different variations. Right? Like I mentioned, it's the spike protein. And if the spike protein is the same in all the variants, then your vaccine is effective against that virus. But if there is a slight variation in that spike protein, your vaccine will not be that effective. So, given how many new variants are coming along, I think we still need to be very cautious and be very careful with getting, even after getting the vaccination.
Dr. Soman, as we are seeing that there are various age groups that are being vaccinated. So, what about our children? When can they get vaccinated?
It's coming soon, is all I can say. So I want to explain how it works for children and how it's different from adults. So when the vaccine studies are held, they are all held in the adult population. And to get approval for the children or a population under 18, the vaccine companies have to do something called bridging studies, where they do smaller studies in children and they have to show that it is as efficacious as well as safe in children. And this is a requirement for all the countries like Health Canada, FDA, the EU region. For all of them, they have to do bridging studies. So these studies are going on right now, and Pfizer has already completed the bridging study for 12 to 18 years. And in the US, the Pfizer vaccine has been approved for 12 to 18 years. So that's the good news. And soon Health Canada will likely approve also for them. And all the other vaccines are doing these bridging studies. So it will be coming soon for children as well.
So, my last question is many people are thinking if they should get vaccinated or not. So, do you think there is a reason not to get vaccinated?
That's a great question because it is true. A lot of people are hesitating. They are afraid of side effects, or they are thinking that perhaps if everybody else gets vaccinated, then I will be safe too. So why should I get vaccinated? But there are really very few reasons for you to not get vaccinated. Now, one of the reasons is if, like I mentioned earlier, if you've had a really severe allergic reaction to a vaccine or a medicine in the past. And when I mention severe, I mean that, unable to breathe, the face, lips, tongue gets swollen. You've required some sort of medication to recover from that reaction, what we call an anaphylactic reaction. Sometimes the body breaks out in hives or big, swollen, itchy patches develop on the skin. That is a good reason to perhaps not get vaccinated. If you have any severe medical illness and you're on some medication, you should talk to your doctor because no matter what medication you're on, what illness it is, even if you're pregnant or you're nursing, those are not reasons to not get vaccinated. Your doctor will be able to guide you well as to what precautions you should take. And also remember that if you are getting vaccinated, wherever you are getting vaccinated, there are always doctors on standby. I myself have attended some vaccination camps where I have administered vaccine to hundreds of people. And we always have medicines at hand to treat people who have the allergic reaction. That we always observe patients for 15 to 30 minutes. Typically, there is any reason that we feel that you might have that kind of reaction, you will be observed for at least up to 30 minutes. And these reactions do occur very quickly. So there is medicines and doctors at hand everywhere, wherever vaccinations are being given. So really, there is no good reason not to get vaccinated and protect not only yourself, but your family, your friends, and society. I just want to add in the end that the best vaccine is the one that is in your arm.
Thank you so much, Dr. Soman, for all this valuable information. This is really an information session that's going to benefit many people around the world. Thank you once again.
Thank you so much.
And with this, we come to the end of this episode. In our next episode, we will be discussing about another important issue on Dhai Akhar voice. Thank you for being with us. Until then, namaskar.